Hello, I'm Dr. Martha Buchanan. I think I'm a minute or two early. Sorry about that. I think everybody's joined in. As I said, I'm Dr. Martha Buchanan. I'm the Director and Health Officer here at Knox County Health Department. We'll be joined by Dr. Gray later in our briefing. He'll be on remotely from UT to give us a perspective from the hospitals. Our moment of gratitude today is dedicated to members of our public information line. We have thanked them before, but they deserve our constant appreciation. They have been providing this service to the public since March. From guidance on quarantine and isolation, to providing education on close contacts, to giving out testing information and resources, they have been invaluable. Lately, most of the calls to the public information line have been regarding vaccine, no surprise. They have experienced an incredibly high volume of calls and are working as hard as they can to provide helpful and useful information to our community. Additionally, they have helped sign up hundreds of folks without internet or computer access for vaccine appointments when appointments have been available. We are grateful for their patience and commitment to helping our community. We ask that you please treat these folks with respect. They cannot control the fact that the demand for vaccine is outpacing supply. This is an issue that's being seen not just here in Knox County, but across the state and across the nation. So please, again, we'll ask for patience and kindness toward each other. We want to take this time to acknowledge the frustration that some of you are feeling. While we would love nothing more than to be able to immunize everybody who wants to receive a vaccine, we simply do not have the supply to keep up with the demand at this time. To put it in perspective, there are more than 30,000 people, 75 and older, who live in Knox County. And that doesn't include the number of people who fall into the other categories, such as healthcare workers, first responders, and others. So it's a large volume of people to get vaccinated with a small amount of vaccine that we have available at this time. As you saw last week, we scheduled multiple vaccination opportunities as soon as we received additional vaccine. We will continue to do that. Some of these opportunities will be in small batches and others will be in larger batches. It depends on how much vaccine we have and how much we get from the state. We can't schedule these appointments or clinics if we don't have vaccine. So please be patient, as it will take some time for us to vaccinate our community. We continue to look forward to when others will be available to provide vaccine. Right now, it's primarily us in the hospitals. Soon, we hope pharmacies and medical providers will be able to get on board. Looking at the big picture, this will allow us, the health department, to further focus on getting vaccine to at-risk minority populations who have less access. These are groups that we as public health focus on all the time, way before the pandemic started. And as more entities come on board, who can provide vaccine, we hope to dedicate additional resources to these groups who don't have other means to get vaccine. This is incredibly important to us. It is the main pillar of who we are here at the Knox County Health Department. As we have continued to say, much like testing, vaccines will take time to roll out. Early on, we were the primary place to get tested for COVID-19. Now that's the case with vaccine. Oh, now that's not the case, sorry. Testing is widely available in our community. To date, there have been more than 300,000 PCR tests conducted in Knox County. That shows the ability the system has to expand and grow. We look forward to when vaccines will become more available in our community, similar to how testing has. For today's vaccination update, we are continuing to vaccinate those who fall within the first priority groups, including healthcare workers, first responders, and those over the age of 75 and older. A full list of qualifying groups can be found on our website and on the vaccine information page. This week we are continuing our vaccination efforts to hold pre-scheduled appointments that were made and filled last week. By the end of the week, we will have administered an additional 1,000 plus first dose vaccines, and that's just the Knox County Health Department. As a reminder, we are not doing walk-in vaccinations. You have to have a scheduled appointment beforehand. All appointments for this week are currently full. We expect to receive more doses this week and will announce additional vaccination opportunities for qualifying individuals as soon as we are able. We are also gearing up to begin providing second dose vaccines to those who've already been vaccinated. For those who've received their first dose with KCHD, we will be reaching out to you directly to schedule a time for you to receive your second dose of the COVID-19 vaccine. Moving forward, we are looking at ways we can develop an automated contact collection system that can be utilized to schedule appointments while also serving as a standby list for times when we have leftover vaccine that needs to be administered at the end of the clinic and other uses we hope moving forward. This is still very much a work in progress. So please don't call the public information line now asking to be added onto this system because it doesn't exist yet. As soon as we have additional information to share, we will announce it to our social media through our social media platforms, our website, and news release during our media briefings. Now move on to the local situation. We have 156 new confirmed cases since yesterday's report, 4,316 active cases, 134 Knox County residents are currently hospitalized, and sadly, we have 2 additional deaths to report, raising our total to 409. And now I'm going to turn it over to Dr. Gray virtually, and then we'll come back for questions.
Dr. Gray, I think you are muted.
Sorry about that. Again, thanks for the opportunity to give an update from the hospital systems. As Martha has mentioned, the hospital systems and the Knox County Health Department continue to work very closely together. And we're proud of that relationship. And I think it has allowed us to make a significant amount of progress in the community during the 10 or 11 months of the pandemic. As in my usual fashion, I want to start from a statewide level and then narrow down to the local situation. As you recall, we saw a peak number of new COVID cases per day on a statewide level back in mid-December, specifically December 16th through the 18th. At that point, we were seeing over 11,000 cases daily statewide, and we peaked at about 744 new cases locally. As we've talked about in the past, those new cases result in hospitalizations 2 to 3 weeks later, and we saw a resulting peak in hospitalizations the first week of January, specifically January 6th. At that time, we had well over 3,300 hospitalizations statewide and nearly 700 hospitalizations within the health systems here regionally. 25% of those were in the ICU and 60% of those were ventilated. The good news is since that time and since mid-December and specifically since the first week of January, we've seen a pretty significant decline in the number of new cases per day and resultingly the number of new hospitalizations. On January 18th or yesterday, we saw less than 2,500 new cases statewide and 183 new cases locally. The result of that was 2,600 hospitalizations statewide, but nearly a 20% drop in hospitalizations here locally over the last 2 weeks, with the demographics of the hospitalized patients remaining relatively the same. That will eventually, has already, but will eventually continue to result in a decrease in the rate of death on a daily basis. I don't want to be overly optimistic, but while I will say we remain hopeful and cautiously optimistic, Tennessee is still an at-risk state as it relates to COVID, and we will remain vigilant for the next several weeks and throughout the rest of the pandemic. As far as it relates to our hospitals, within the walls of our hospitals remain safe places to seek care for COVID and non-COVID related issues. We continue to effectively manage our COVID census, both collectively and on an individual basis based on the hospital system and based on the local hospital within that system. We are meeting daily to look at capacity and vaccination strategies. The CMOs and CEOs continue to meet once per week for strategic planning. We're screening visitors and team members. We're still wearing face coverings. We continue to restrict our visitation to 1 visitor to limit foot traffic on our campus and to limit unnecessary exposure to our patients and team members. Our COVID active patients and patients under investigation continue to be segregated from the rest of our population. Our PPE supply chain continues to be open and adequate. Our surge capacity currently is still at red for now, And the question you may ask after my intro is, why do we remain red for now with the decline in the number of new cases and hospitalizations? I want to caution against a normalcy bias. Even with that decline, we are still at historically high levels prior to December. So again, we're still seeing over 500 folks hospitalized in the region, whereas prior to December, we weren't anywhere near those numbers. Some good news for the local community. Based on the decline in the number of hospitalizations, there are plans in place to resume elective cases soon. Those dates will vary by hospital system. To piggyback on what Martha said, we continue to work closely with the Knox County Health Department to strategically and safely get the community vaccinated as quickly as possible. It's important to note that the health systems are following the Tennessee Department of Health's vaccine allocation guidelines, as we received a limited number of COVID-19 vaccine doses. The response has been overwhelming, as you can imagine, but we are currently filling our appointments based on vaccine availability. Our goal is to vaccinate as many people as quickly and efficiently as we can with the limited number of supply that we have to help create a healthier and safer community. Now that we have moved through most of the 1A1s and 1A2 categories, as Martha mentioned, we've shifted our focus to helping the Knox County Health Department vaccinate other populations that are eligible. I want to shift pretty quickly again to remind you that Medic continues to need blood products, all types of blood products. Again, they are unable to go into local places of employment to have blood drives. And so they continue to need our community to donate blood and blood products. In summary, we've seen a decrease in the number of new cases, resulting in a decreased number of hospitalizations and hopefully deaths over the past several weeks. We continue to test widely and advocate for testing if you are sick. Although we continue to meet the comprehensive acute care needs of the community, the hospital focus has shifted somewhat to getting our community vaccinated in partnership with the Knox County Health Department. Also, part of our strategy is educating the community on the importance of vaccination and ensuring equity in the process. And lastly, we must remain vigilant and continue to advocate and follow the 5 core actions. And so I'll stop there and make room for questions.
Okay, thank you, Dr. Gray. We'll bring Dr. Buchanan back in. And as we typically do for days like these, if you have a specific question that's geared to either Dr. Gray or Dr. Buchanan, please type that in to your question so we know who to ask it of. The first question we have is from David with WVLT. Has there been, and I believe this is to Dr. Buchanan, has there been any more discussion about adding a wait list for seniors looking to get COVID-19 vaccines? If so, how soon could we see wait lists added? And if not, why not?
So that's what I talked about at the very end of my prepared remarks. We're looking at options to provide that for not just seniors, but anyone who fits into the risk categories, because I know we focused a lot on seniors, but others in that category are also disabled individuals who can't live outside the home by themselves, still live at home, but not in a home. And healthcare workers still need vaccine as well. So we'll be opening those up. We'll also be doing some partnering with the community and with partners that we're working with to outreach specifically to folks who might not have internet access or maybe just not comfortable scheduling an appointment online. So we want to have those options available to provide anybody who wants to get vaccinated the opportunity to get vaccinated. But again, I just want to remind everybody, for the foreseeable future, demand is going to outpace supply, and there's nothing any of us can do about this. There's nothing the hospitals can do about that. There's nothing the health department or the state can do about that. That's beyond the control of any of the folks here involved in vaccinating.
The next question we have is from Allie with Knox News, I believe also geared towards Dr. Buchanan. Should people go to surrounding counties to be vaccinated if they can't get an appointment in Knox County?
We encourage people to get vaccinated in their county of residence. That being said, we know that people go outside Knox County, and when we have our clinics, we see people coming from other counties to get vaccinated. Vaccine is allocated based on population, and for that reason, we do encourage people to stay within their county of residence to get vaccinated, and acknowledge that counties will move through these phases in different ways, in part because of size of population. If you look at a really small rural county, there's not a whole lot of 1A1 and 1A2 people who live in that county. So that they were able to move through that population pretty quickly. So they might have appointments available sometimes when the larger counties don't. It's not because people aren't trying to get people vaccinated. Just supply gets taken up. Our appointments last week, I think, were filled in a very short period of time. So we know demand is high, and we're grateful for that. We will continue to push vaccine out as much as we can.
The next question we have is from Jeff with WATE, directed to Dr. Gray. He says, a viewer contacted us claiming that UT Medical Center is vaccinating hospital workers' family members, even those who may not meet CDC guidelines, and holding a lottery to do so. Is that true?
So as I mentioned before, the University of Tennessee Medical Center, and I think I speak for all the other health systems, continue to comply with CDC guidelines. We continue to also comply with the Tennessee Department of Health allocation phase eligibility. We are, as Martha mentioned, we have moved through most of the 1A1 and 1A2 categories and have partnered with Knox County Health Department to begin to vaccinate those patients in that 75-year and older category.
And then Jeff's next question also for Dr. Gray was, what fraction of your staff has been vaccinated, and will you open up vaccinations via the hospital to the general public as another hospital group has done?
So we're still trying to determine the exact numbers of our team members that have been vaccinated. Historically, as you recall, I think the last time we were here, we did a straw poll to understand the interest, and we had a little bit less than 50% of people that said they would absolutely take the vaccine when it became available. I will tell you that the response has been significantly greater than 50% of our team members have had interest and signed up for vaccination. We've seen those trends across the state. I think those are listed on the Tennessee Department of Health website about the change in attitude as education around the vaccine has been circulated and the side effects have been well profiled and described. So we will have that number hopefully soon, an exact number, but it's definitely greater than 50%. In regards to making vaccine available for the community, again, we are already doing that. I think collectively for the hospital systems, we will have vaccinated thousands of members of our community greater than 75 years of age by the end of January.
All right, the next question is from Grace with WBIR for Dr. Buchanan. A lot of nearby counties are having success with drive-through vaccines and are able to have people safely wait in their cars in case of allergic reaction. KCHD has mentioned finding a space big enough as a challenge. Why else is a drive-through not being considered? And is it something we could see in the future?
We are discussing different options for providing vaccine. One of the other drawbacks to a drive-through is that you're outside, and the weather is not really conducive to being outside right now. So that's one of the challenges as well. We're able to vaccinate as many people in a walk-in model as there is being done in most of the drive-throughs across the state. We've shifted to an appointment-only schedule, not the first come, first serve event that we had. Yes, people waited in line. They chose to do that. We've shifted to an appointment schedule. We'll be having people wait in the parking lot in their cars. So we are confident in the safety of our model. Others have chosen to use a different model because of their needs or because of their capacity. And that's totally fine, and we respect that. They're all valid ways to get people vaccinated.
Next question from Allie with Knox News, I believe directed to Dr. Buchanan. Covenant Health and UT Medical Center vaccinated some patients 75 and older last week. Is this a sign that supply is catching up to demand?
No, it's not. It's just a sign that we work together as a community to get our community members vaccinated. Here in Knox County, we fully embrace our public health system, which involves the hospitals, community members, community organizations, and public health. And as such, we work together to vaccinate folks. So they've been able to shift focus from their employees to helping us vaccinate not just those 75 and older, but also healthcare workers who maybe don't work at a hospital, but have patient-facing jobs. So they're working with provider groups and with offices to get those folks vaccinated, as we are as well. And so we're very grateful for that partnership with all of our hospital systems. Together, I believe we provide options for people to get vaccinated in a way that they're comfortable. And I think the more options we have where people get vaccinated, the more quickly we'll be able to vaccinate everybody in our community.
Grace with WBIR for Dr. Buchanan. Has there been any vandalism at KCHD?
So I'm sure a lot of you saw over the weekend, there was some spray paint on one end of our building. And so, yes, there has been. That's been reported appropriately to the authorities. And, we're certainly concerned about those things, and we'll continue to be vigilant in ensuring safety for our employees and those who come for services at the health department.
Also from Grace with WBIR, other states or counties are giving people a heads up before vaccine appointments open. Is that a consideration for the future?
We are releasing vaccine appointments when we're able to, when we know we'll have vaccine. Last week, we got that out when we knew we had vaccine. We don't want to release appointments and not have vaccine for those appointments. People are anxious and frustrated and wanting to get vaccine, and we really appreciate that. But as soon as we're able, we are getting the information out to the public about when vaccine appointments are going to be open.
Also from Grace with WBIR for Dr. Buchanan, you mentioned you'll be receiving more vaccine this week. Any idea how much more and how many are first doses versus second doses?
We actually received our second doses last week for the first doses we'd already given. So we have those and they match dose for dose for the number of vaccinations that were delivered or vaccines that were given. So for our first dose, that allocation comes from the state, and we know for sure how much we're getting when we get it in our hands.
From Austin with WATE for Dr. Buchanan, what is your message to those who have vandalized your offices?
Anytime somebody chooses to express themselves in such a manner, it's disappointing and discouraging. And I would ask that folks treat this building and the staff and the people that come here and the people that work here with respect and not engage in such behavior.
Next question from Grace with WBIR for Dr. Buchanan, I believe. How would you describe the downward trends we've been seeing? Do you think your contact tracing decisions have had any impact on case counts? And if so, how?
I don't think that our contact tracing decisions have had any impact on case counts. Case counts are case counts. They're people who get tested and they're positive. People choose to get tested for different reasons. So I don't believe that that's had any impact.
Also from Grace with WBIR to Dr. Buchanan, is KCHD looking for the new variant?
So looking for the new variant occurs via the Centers for Disease Control. I believe that the state of Tennessee is participating in sending some samples, like other states are, to the CDC for genotyping, which is how you would find the new variant. New variant is not a surprise. Viruses mutate and change, or viruses change periodically, so it's not uncommon to see a change. And so it's not a surprise that this has happened. And, it doesn't change how the virus is passed. The virus is still passed the same way. So the 5 core actions continue to be your best defense until you can get vaccinated. And even after you get vaccinated, you still need to follow the 5 core actions. So social distancing, wearing a mask, washing your hands, staying home if you're sick, cleaning surfaces regularly, avoiding crowds is also another thing we want you to do. And now get vaccine when it's available.
From Allie with Knox News, Biden's vaccine plan includes providing information regularly about how much vaccine states can expect and when. What would that mean for KCHD, and how much easier would it make vaccine distribution across eligible populations?
So that's a great question. And I can't really predict what's going to happen. I don't know what the Biden administration, what the details of that plan look like. And then, the federal government releases vaccine, and then it goes to the state, and then the state allocates that. We do look forward to having more vaccine and being able to vaccinate more people. And we are planning ahead for the possibility of getting more vaccine in the near future. So we're excited about the possibility, but we'll have to wait and see what the details are.
From Grace with WBIR, do you expect UT returning to impact the local situation? And if so, how?
Well, it certainly could. More people coming back into our community that haven't been here for a little while. And they have been in various places doing various things. And if the return after Christmas is a repeat of the fall, we'll see an increase in cases among that age group. I'm hopeful that the students learned from the fall what to do, what not to do, and how to keep themselves and their friends and loved ones safe.
From Allie with Knox News, can you explain why additional eligible groups like those 65 and older, grocery store workers, et cetera, could not be vaccinated immediately if they were added to the state's plan? How long would it realistically take to vaccinate additional groups on top of those who are already eligible in Knox County?
So right now, what we know is that we are not getting enough vaccine on a regular basis to be able to vaccinate the existing risk groups, the existing groups in these phases. So increasing that is not going to make more vaccine available. It doesn't change the availability of vaccine just to add people into the phase. And if we look at the numbers, if we just look at 75 and older, it's a little more than 300,000 people, 30,000, sorry, not 300, 30,000 people. And then if we add the 65 and older, that jumps us up to 70,000 people. So it's a big jump. I think when more vaccine is available, it makes sense to add people in, but we just don't have the vaccine to even vaccinate the groups we're trying to vaccinate now. So adding groups to that population would just, I believe, increase frustration.
The next question is from Grace with WBIR for Dr. Gray. Are you all receiving regular vaccine shipments, and are you coordinating with other hospital systems to see if they have any extra vaccine?
So as Martha has already alluded to, we are not receiving regular vaccine shipments. Early on in the process, when the focus was the 1A1 and 1A2 categories, we provided the state with estimates of the number of vaccines that we needed to get our frontline workers vaccinated. Now that we are moving out of those phases and into vaccination of the population at large, the focus has shifted to providing the Knox County Health Department with vaccine, although it still remains irregular. And so our job now is in an assistance role to help them vaccinate the community, but we are not receiving regular shipments of vaccine at this point.
All right, any further questions, please go ahead and submit them. From Brian Hornback, why are vaccine supplies not flowing?
That's a great question. Excuse me. I guess for the federal government and the manufacturers, and the manufacturers of vaccine, we can only rely on what we get from the state. Excuse me.
The next question we have is from Allie from Knox News. It looks to be a question for Dr. Buchanan. Is KCHD still considering changing the COVID-19 information phone line number for vaccine appointments?
Different options for that, and I'm trying to work out a system that is helpful to everyone. So again, that's part of the work in progress to get things in place so that we can have some predictability and collaboration with some different partners to make that happen.
Next question, and this probably will be the last one we're able to take today because of time. We have from Jeff with WATE. It's for Dr. Buchanan. Can you explain how the additional vaccine appointments came about last week? Were those a surprise shipment? Were they otherwise unused vaccines from other situations?
So I guess, are you talking about the Friday scheduled clinic? Those were doses that we received from the state of Tennessee. And the reason we waited to announce it, because we wanted to know we were going to have those doses in hand before we put appointments out there. We really don't want to put appointments out there, let them fill up, and then have to reach out to those people and say, sorry, we didn't get the vaccine. That to me is a lot more frustrating than waiting until we know we have vaccine to learn about a scheduled clinic.
All right, and that is all the questions that I see for today. And since we're running out of time, we'll cut it there. Thank you all for your time today, and a special thanks to Dr. Gray for joining us as he regularly does. So we appreciate that, and we will see you all again on Thursday at 12:30. Have a good and safe rest of your day.
Thank you.